This video format is designed to help you prepare for Objective Structured Clinical Examinations, or OSCEs. You are going to observe and participate in a clinical encounter of a 10-year-old child who comes to the office with a complaint of vomiting. As you observe the encounter, you will be asked to answer questions while the image on the screen freezes. These questions will allow you to practice history-taking and physical examination skills, as well as your clinical reasoning in developing an assessment or differential diagnosis and a plan, that is, an appropriate next diagnostic workup. You will have time to record your findings and receive feedback.
What brings you both in today?
Well, Tommy's been throwing up nonstop for the past day, and I'm worried something's really wrong since he doesn't look himself.
I'm sorry you don't feel well, Tommy. I'm going to talk first to your mom, and then I'll ask you some questions to try to figure out what's going on.
Okay.
Tell me more about the vomiting, exactly how often it's been, and if there's any pattern to it.
What diagnoses are you considering at this time? Viral gastroenteritis, bacterial gastroenteritis, food poisoning, gastritis, migraine. You may need to rule out CNS disease with headache, but diarrhea makes this less likely.
He's thrown up 3 times today and twice yesterday, but I haven't really noticed a pattern. It's just too bad because yesterday was the first day of school.
I want to ask you more about the vomiting, and then about other things going on. Is Tommy bringing up a lot or a little when he vomits, and what comes up?
Yesterday he first threw up his whole breakfast, and in the afternoon he vomited up the soup I gave him. I obviously kept him home from school. This morning I gave him some broth, but he threw that up as well, and an hour later he had the dry heaves. He vomited a bit just before coming in to see you.
Does he have nausea with it, or does it come out of the blue?
He's been complaining of feeling sick to his stomach, especially after he eats something, but when he's thrown up, it came without warning.
So most of the time, it's been after eating something?
Yes, that's right.
Can you tell me whether he has had any other problems?
He's had a little diarrhea, although I haven't really checked when he's gone to the bathroom, and he's been complaining of a headache, and he just doesn't feel well. And he says his stomach's been growling and hurting.
Has he had a fever?
Yes, I think so. I've been checking his forehead and he feels warm, but I don't have a thermometer.
Is anyone else in the family sick with vomiting or diarrhea?
No, thank goodness.
Has he been in contact with anyone with these symptoms?
Well, he just got back from soccer camp the night before this started, and I did hear that a couple of the boys at camp got sick. Tommy, is that right?
Do you know if they were sick with vomiting or diarrhea or both?
David and Jimmy both threw up on the bus coming back. It was really gross.
Does Tommy have any food intolerance or food allergies? And has he ever had this type of reaction to anything he's eaten before?
No, he doesn't have any problems with any foods, except that he eats too much junk food.
Okay, now tell me more about his headache.
Well, he's complained of stomach aches, especially before he throws up. And he's complained of headaches, especially after throwing up. He tends to get headaches, whenever he's stressed. I can relate since I get migraines myself.
Has he had migraines or headaches like yours before?
No, thank goodness. I think his headaches are just nerves.
And has he complained of these headaches in between the vomiting?
No, not really.
Has he awakened in the middle of the night with headaches or with vomiting?
No, I'd remember that.
Has he taken any medications, even over-the-counter medications?
No, just his usual vitamins.
Tommy, I need to ask you a few questions now. Do you feel well enough to talk?
Yes.
Can you tell me how often you have pooped today?
3 to 4 times.
And did it look like normal or different?
Well, it was really watery and smelled awful.
Did you look at it?
Yes.
Tommy, I know this is gross, but what did it look like? What color was it? And did it have blood in it?
Yeah. Yes, it had some red stuff in it. I don't know if it was blood, and it was kind of slimy and greenish, and it smelled so bad I just flushed the toilet really quick.
Tommy, did you drink anything with red in it today? Like a red-colored juice or anything like that?
No, I've just been drinking water and apple juice.
Now tell me about your stomach ache, like where it hurts and when it hurts.
It hurts here. It feels like crumpling inside, at least sometimes.
And does it hurt all the time or just sometimes?
Just sometimes, but it feels better when I puke.
Are you having any pains right now?
No.
Oh, good. Now tell me about your headaches. Have they been really bad?
No, just a little once in a while.
And have these headaches stopped you from doing anything?
I haven't really been doing anything except lying on the couch and watching TV. I've had my throw-up bowl with me.
Have you had any problems seeing or any dizziness?
I broke my glasses at camp.
But around the time of your headaches, did you have any problems with your eyes or any dizziness?
No,
Have you had any other pains anywhere?
just my knee.
What's wrong with your knee?
David kicked me with a soccer cleat, but I got him back.
Okay, stay with me, Tommy. Have you been hungry at all or feeling like eating?
No, I've just been drinking a lot of stuff, though, since Mom says I have to stay hydrated.
I think she might have meant hydrated. Well, I'm glad you've been able to drink. During your trip or after, since you've gotten back home, have you taken any medicines or swallowed anything that you haven't ever had before?
No,
What grade are you going into?
the 5th grade. I have Mrs. Deming this year.
What do you think about missing the first 2 days of school?
I'm bummed. I have a bunch of friends in the homeroom this year, and I haven't seen them all summer.
Well, we'll try to get you back to school soon, Tommy. Is there anything else that you wanted to tell me?
No,
Mrs. Green, is there anything else I should know?
No, I don't think so.
With the patient's health history in mind, and after good hand hygiene, you are ready for the physical examination.
Right over here, Tommy. You know, Tommy, you move pretty good for somebody who's sick.
yeah, it seems to come and go. Sometimes I feel worse.
What regions of the physical examination are important in this patient? General appearance, head and neck. Hydration status, skin and mucous membranes. Heart and lungs. Abdomen. Neurological exam.
Tommy, I see that you have a slight fever of 101 degrees. Your blood pressure is normal. It's 100/65. Your heart rate is normal. In other words, how fast your heart is beating. It's 90 per minute. And you're taking about 20 breaths per minute, which is normal for your age.
Okay.
Now I'm going to examine you.
Examine the head and neck. Check for hydration status by examining the tongue and lips. Feel for skin turgor.
Everything looks good so far, except that your lips are dry since you've been sick.
Examine the lungs.
Okay, Tommy, I need you to take a deep breath through your mouth.
Examine the heart. Examine the abdomen.
Tommy, your belly's really rumbling. Does it hurt right now?
Yes, a little.
Can you show me where it hurts?
Right here.
Palpate the abdomen, testing for guarding and involuntary rigidity.
Does that hurt?
No, not really.
Okay, Tommy, which hurts more? When I push in? Or if I let go?
A bit more when you press in.
Test for rebound tenderness.
The same.
What about here?
Same.
Percuss the abdomen.
Now I'm going to feel your belly with my hand.
Palpate the liver. Palpate the spleen. Perform an abbreviated neurological exam.
All right, Tommy, clench your teeth now. Okay, Tommy, now I need you to scrunch your eyes, all right, like this. Okay, Tommy, now I need you to smile real big. Tommy,
Perform a cerebellar exam
and touch my finger.
and test gait, strength, and coordination. List your diagnostic considerations in order of importance and explain your rationale. Press pause and list your answers. Resume when you are ready to receive feedback. Bacterial gastroenteritis. This previously healthy 10-year-old has an acute episode of vomiting, intermittent abdominal pain, diarrhea with occasional blood and greenish color, low-grade fever, and a history of contacts with other children having similar symptoms while traveling. The physical examination shows a child who is not extremely ill and points to an abdominal etiology with hyperactive bowel sounds, mild tenderness, and tympanitic abdomen on percussion. These symptoms and signs point to an infectious gastroenteritis, bacterial or viral. The blood and mucus in the stool increases the likelihood of a bacterial etiology with pathogens such as Shigella, Campylobacter jejuni, enterotoxigenic E. coli, ETEC, or Salmonella. Indicators for severe disease are signs of dehydration, poor skin turgor, tachycardia, drop in blood pressure, significant abdominal tenderness, or mental status changes, none of which is present in this child. Viral gastroenteritis. Viral gastroenteritis in a child can present with all of the symptoms and signs noted in this patient. These include diarrhea, vomiting, fever, abdominal pain, anorexia, headache, malaise, and myalgias. The latter was not noted in this patient. Frequently, an early symptom involves vomiting, and after 24 hours or so, the vomiting diminishes and diarrhea remains for several days. On examination, children typically look healthy, except for signs of mild dehydration, that is, dry mucous membranes noted here, or poor skin turgor, which was not noted. And sometimes there is mild tenderness on abdominal examination, but without signs of obstruction, that is, no guarding, rebound, etc. Stools are typically loose, watery, and pale-colored, without blood or mucus. Major etiologies include rotavirus, especially if not vaccinated, if a young child, or if an older child, such as this patient, norovirus, or one of multiple other viral pathogens. While the symptoms of this patient are typical of viral gastroenteritis, blood and mucus in the stool make it somewhat less likely than bacterial gastroenteritis, or even a parasite such as Giardia. Food poisoning. Foodborne disease can produce a sudden onset of nausea and vomiting, and also a sudden onset of diarrhea. Typically, multiple individuals will develop the symptoms simultaneously, particularly when the etiology is a toxin, such as Staph aureus enterotoxin. Foodborne disease can produce the same constellation of symptoms as typical gastroenteritis, including vomiting, nausea, diarrhea, headache, malaise, and intermittent abdominal pain that coincides with cramps. Common pathogens include Staphylococcus aureus, Bacillus cereus, norovirus, and a host of other agents such as Salmonella, Campylobacter, Shigella, Cryptosporidium, and Shiga toxin producing E. coli 0157. This patient has many of the above symptoms, but the delayed onset compared to other children and blood and mucus in stools make foodborne illness less likely. Gastritis. This 10-year-old boy presented with symptoms of vomiting, which was worse after he ate, and he also had intermittent abdominal pain and pointed to his belly button area instead of right lower quadrant or lower abdomen. Gastritis, which is usually due to infectious or autoimmune disease or potentially triggered by stressful situations, typically presents with epigastric pain, sometimes worse after eating, nausea, and vomiting. Usually there is little diarrhea and typically no fever or headache. Sometimes patients will describe a burning sensation in their stomach or even up in their chest. Etiologies include infections, particularly Helicobacter pylori, but multiple viruses and bacteria can also be pathogens. Exogenous, that is, NSAIDs or alcohol, and autoimmune. This patient's diarrhea, diffuse abdominal pain, headache and malaise, lack of tenderness in the right upper quadrant, and lack of stress as trigger all make gastritis less likely. Migraine. Although the patient had intermittent headaches, had a history of headaches, and a family history in the mother, and although abdominal pain and even vomiting are occasionally part of the child's migraine constellation of symptoms, a number of factors make this etiology less likely. First, the headache was not a major symptom, but a secondary or minor one. Second, the presence of diarrhea, fever, and mild abdominal tenderness, and history of vomiting after eating, rather than a pattern of vomiting with headaches, all make migraine unlikely as an etiology for this acute presentation. Of note, the normal neurological examination also makes increased intracranial pressure a very unlikely cause of the child's vomiting, as does the absence of vomiting or headache at night. List 5 next steps in your diagnostic workup. Press pause and list your answers. Resume when you are ready to receive feedback. Please note that a key to the workup is to perform a limited set of laboratory tests to help triangulate toward a definitive diagnosis and to target therapy, but also to limit unnecessary tests. Since the child looks well, a blood culture is not necessary. Similarly, although gastritis and migraine are on the differential diagnosis, they are much less likely than infectious causes of gastroenteritis, so that tests such as Helicobacter pylori are not indicated at this point. Also note that we will show 5 laboratory tests for completeness, when in actuality a good pediatric clinician may recognize that a patient who is recovering, such as the one presented here, may require only good monitoring of the symptoms without needing any testing. Complete blood count and metabolic profile. A rise in the white blood cell count would be suggestive of a bacterial process. Shigella infection is typically accompanied by a very high white blood cell count and left shift, but any bacterial gastroenteritis can cause these abnormal laboratory findings. Eosinophilia would be suggestive of a parasitic infection. Anemia would be unlikely, but could be secondary to blood loss in the stools. The metabolic profile can be helpful in assessing a child who is dehydrated or acidotic secondary to severe diarrhea, although highly unlikely in this case. Certain bacterial causes of diarrhea, E. coli 0157, H7, or Shigella, can rarely cause the hemolytic uremic syndrome, which can result in acute renal failure. Thus, while this is not the major rationale for obtaining a metabolic profile, a normal blood urea nitrogen and creatinine in this situation is reassuring. Stool culture for bacteria. A stool culture for bacteria is the best test to identify a bacterial cause of this child's diarrhea and is positive in a reasonable percentage of cases, depending on the situation, of acute diarrhea in children that is accompanied by blood or mucus in stools. A stool culture is helpful to identify the pathogen and, if positive, to tailor antibiotic therapy to go along with supportive therapy. Viral antigen test for rotavirus. Despite vaccination, rotavirus still causes substantial pediatric diarrhea in developed countries and even greater disease in developing countries. A rapid antigen test for rotavirus is used widely. Although viral gastroenteritis is treated with supportive care, a positive test can prevent further workup and reassure families of the etiology. Viral stool culture for norovirus or other viruses. Norovirus is a major cause of viral gastroenteritis and foodborne disease in children and adults. Viral cultures can detect norovirus or other viruses. While knowledge of the specific viral etiology does not by itself assist in therapy, it can provide an answer to the cause of the illness, limit further workup or treatment, such as antibiotics, and help tailor supportive care. Stool for ova and parasites, such as Giardia lamblia. Although parasitic infection was not included in the 5 diagnostic considerations above, it can cause the constellation of symptoms in this child and is treated by antiparasitic medication. Thus, clinicians who test stool for bacterial etiologies often simultaneously test the stools for ova and parasites. In the United States, by far the most common parasite is Giardia lamblia. In sum, the patient is a 10-year-old boy with acute intermittent vomiting, moderate watery diarrhea with blood and mucus, intermittent abdominal pain, malaise, and headaches. He has a history of travel and contacts with other children who had similar symptoms. On examination, he looks generally well, although mildly dehydrated, with a low fever, dry mucous membranes, and a slightly tender but benign abdomen with hyperactive bowel sounds. Diagnostic considerations include bacterial gastroenteritis, viral gastroenteritis, food poisoning, gastritis, and migraine. The diagnostic workup includes CBC and metabolic profile, stool culture for bacteria, viral antigen test for rotavirus, viral stool culture for norovirus or other viruses, and stool for ova and parasites.